Welcome to this Health Suppliers segment here on Health Professional Radio. I'm your host, Neil Howard. I'm going to have a conversation with Mr. Ken Cahill, CEO of SilverCloud Health, and he's going to talk with us today about the gap that exists worldwide when it comes to treating mental health. And he's also going to talk about what his company, SilverCloud Health, is doing to close that gap. Thank you for joining us today, Ken. How are you?
Very well. Thank you, Neil. Thank you for the opportunity to join.
Very glad that you could join us and take the time today. Well, who is Mr. Ken Cahill other than CEO of SilverCloud Health?
Who is Ken Cahill other than the CEO of SilverCloud Health? I think if you ask most people in the kind of position that we are in a kind of rapidly scaling business, Ken Cahill, as being the CEO of SilverCloud Health, is probably 80% of who I am in terms of the amount of time and effort it takes up within life. That all being good, I'm also a dedicated husband of one and a dedicated father of two as well. Who I would describe myself as is I'm extremely passionate in terms of how we can apply technology into the area, particularly the area of healthcare for the kind of the betterment of many people. And that was one of the things that attracted to me to SilverCloud, both in terms of the team, the research, the evidence base, the efficacy of SilverCloud, and also the social and economic good that SilverCloud was striving to do and indeed has done over the past number of years.
Well, we're talking today about this gap that exists worldwide in mental health care. Would you say that mental health is at the center of overall health?
Yeah, for me, absolutely. I'm not a clinician, so I certainly don't profess to be one. But my understanding of what I've understood in terms of so far along this journey, both with SilverCloud and generally with life, mental health is the reason that you or I or any of the listeners got up this morning. It's the reason we hold down a job. It's the reason that we hold down a relationship and other parts of our lives. It is the center to everything that we do. Mental health is, as Dr. Cahill put it previously, we can affect more through mental health than we can through 1,000 different sensors or digital technology devices. It impacts our medication adherence, our compliance in terms of adhering to different types of regimes and behavioral habits, all the way through to our sort of cognitive framing, how we would reframe, how our resilience, how we bounce back from challenges and adversity in life. It is absolutely the kind of the cornerstone of everything, probably not the cornerstone, the keystone, indeed, of everything that we do. So, yeah, I would absolutely profess that it is central to everything. And if we look at, the CDC, the Center for Disease Control, would say that about 1 in 4 of the global population will have a diagnosable mental health disorder, issue, or condition in any given year of their lives. It is one of, if not the greatest social and economic challenges that presents itself to us today worldwide. And it really hasn't been successfully delivered digitally or I suppose move with the times in terms of being able to be accessed in an easier, earlier way, like all other parts of our daily lives are. And there's no reason why it shouldn't be. That was one of the kind of overarching sort of research theses behind SilverCloud when it was still an academic and clinical research project, was looking at the existing solutions in this space and saying, what are the big issues here in terms of that are creating the barriers that limit the level of effectiveness of digital delivery of mental health? And they are high levels of client or patient dropout, low levels of client or patient engagement, and limited levels of clinical improvement. So essentially, these solutions are great in paper and in theory, but when they actually get delivered in real world, they fall very far short of what they were intended to do. So that's where the team developed SilverCloud, and we spun that out from that research in 2012. And we're very proud to say since 2012 we have delivered the platform to 200,000 clients. We prefer to refer them to as clients rather than patients. Delivered to 200,000 clients so far, with about half of those in the last year. So the the ramp-up rate has been phenomenal, and we're extremely proud of that.
What would you say caused the gap in mental health care that SilverCloud is striving to close? What's the reason that this gap exists in something that is so integral in everybody's life as far as health is concerned?
I think there's been a number of different shifts and changes. I think there's been this kind of the popular term being the consumerization of healthcare, which is kind of really about the sort of education from a patient or user's perspective. They're looking for delivery that is an alternative to medication and pharmacotherapy. Mm-hmm. They're looking for destigmatized access to healthcare. They're looking for access that is earlier and easier. When they, on average, somebody with depression will effectively suffer with depression for anywhere between kind of 5 and 7 years, and with anxiety anywhere between 10 and 13 years on average. So when somebody discovers or kind of comes to this sort of realization about seeking healthcare, then being told to go into a holding pattern or onto a wait list is less than ideal, to put it mildly. So we've had this kind of shift in terms of health systems crumbling because they need to offer care. There not being enough resources to deliver the level of care that was traditionally perceived as being, 8, 10, 12 face-to-face, 1 hour face-to-face sessions to a user, just simply isn't scalable in terms of both the therapist network and the behavioral health network that exists here in the US and also in the rest of the world. One of the interesting stats that I read recently was that 44% of all therapists will retire in the next 4 years. So this issue is only getting more and more acute. It's becoming a bigger and bigger issue. So it's this almost a lunar alignment in some ways, insofar as, the movement and shift towards more value-based care delivery, because we can't continue to do what we're doing right now. The acceptance of digital delivery and more almost the push-pull of digital delivery. So not even just the acceptance, but the want to have access to digital access that is effective and is sort of self-paced and is in the correct sort of dosage rate. And then the clinician saying to us, well, we don't want to push them out into an external provider network and they kind of fall between stools, or, necessarily put them straight onto pharmacotherapy where it's not immediately evident that is the best route forward. We want to have more within our sort of portfolio of offerings outside of a script pad and pen. So it's this very interesting change. You could list out maybe 30 things, from broadband access, the increase in access to technology and technology devices, the acceptability of the way we consume data nowadays, all the way through to the consumerization, the increase in sort of awareness of, I am entitled to have a second opinion. I am entitled to another or alternative method of access to healthcare, one that is, more on my terms and my time to fit with my extremely busy schedule, with my family life, whatever it might be. Mm-hmm. And clinicians are the same as well. They have a limited 6 to 11 minute window to help support the person in the clinician's office. And they're being asked more and more to do mental health screenings, and they're saying to us, well, I'm seeing more and more because I'm asking more and more people. I'm seeing more and more people raise a flag in terms of risk around depression, anxiety, stress, and other issues like that. And our health system can't handle it. We need some way of scaling, and the only way to scale is digital delivery.
Well, where can we go online and learn some more? Give our listeners a website where we can learn more about digital delivery and also about SilverCloud Health.
Yeah, so in terms of SilverCloud Health website, the website address is www.silvercloudhealth.com. And from there, you'll see a whole list of research and evidence-based white papers through to full randomized control trials of how the SilverCloud platform has been delivered by health systems. So what SilverCloud does is we do not offer the platform direct to the end user or client. What we do is we enable healthcare organizations, health systems, payers, providers to be able to offer out SilverCloud at a greater scale than offering it direct to the end user. From an end user's perspective, there's some really great advocacy groups out there like Mental Health America and others internationally, through sort of NHS Choices in the UK, as well as many more around Europe as well, that are really there to try and help signpost and identify and indeed flag the risks early for a user.
Well, Ken, it has been a pleasure talking with you today. Thank you for taking the time here on Health Professional Radio.
No, thank you, Neil. Thank you. It was great to talk to you, and thank you for the opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.